Just before that, Assalamu alaikum and very good afternoon to everybody. And thank you very much for a very generous introduction. And I feel pleasure to join with the conference, although it is online. So once I share my screen, if I close my camera for a minute, hopefully that should be okay. But people, if just allow me.
Yes, that's definitely fine. Please.
Start sharing the screen. Just confirm it if that's okay.
Yes, it's visible.
Perfect. Right. So if there is any interruption in between, Aisha, just let me know.
Sure,
So just to start with, I know it is a conference for eating disorder, and the word addiction bringing in sounds a little bit harsh. But I think it's just we need to appreciate that when it comes to food, research has shown that our brains respond as strongly to highly processed foods, especially those highest in sugar, simple starches, or high fat content, they do to tobacco, alcohol, and other addictive substances. It's not different. So for today, I will just focus to discuss the implications of compulsive behavior relating to highly processed food, evidence of highly processed food substance use disorder, how it is similar to each other, and revisit various aspects of food addiction and management strategies. So first of all, if we look at the prevalence of food by age group, the studies have found mainly, I think, in the Western world, the more than 1 in 8 middle-aged and elderly Americans are addicted to ultra-processed foods. A national survey recently conducted, it found that 13% of adults 50 to 80 exhibit signs of food addiction, including physical withdrawals, eating more than planned, and an inability to cut it back. If we look at by body weight of individuals, the studies have shown, is a little bit of shown in this form, chart form, measured that the prevalence of food addiction measured by Yale Yale food addiction scale was 7.9%. Individuals meeting criteria of food addiction had higher BMI and were younger than individuals not meeting the threshold. So underweight, obese people, or individuals who were overweight, they have shown, you can see the different percentages. So the most prevalent, it's seen in obese, highly obese people. Although the people, can see this interesting, the people who are underweight, they are not excluded for various reasons. I'm sure you would have discussed various aspects of eating disorder over the last day or so, and how we see our slightly underweight individuals with a new anorexia, bulimia, and their addiction comes in a different way. which actually oscillates between binge, etc. But that is a separate topic at the moment. These are the figures we've shown. The only people, they are either slightly overweight or normal weight. They are at the lowest curve of this spectrum of findings. Now, when we see about the drugs, when we appreciate that those drugs which have increased dose with a rapid rate of absorption, they have high addictive potential. And if I apply this formula, so highly or extremely or ultra processed food. So we look at highly processed food with increased dose of rewarding ingredients in it. Maybe our cultural background look at spices and sweet and etc. Chat kharedar. And with rapid rate of absorption, you are going to see high addictive potential with this food. So I'm going to show you a few of these findings. I've gone through some studies by Schultz, Savina, Gerald Hart, 2015, and you see various food items and their frequency and how much people can be addicted. So chocolates, looking at, so you can look at this profile of these food items, especially who have obviously high absorption rate and very quick response and ingredients. So chocolates, 27.6%, ice creams, you can see French fries, pizza. We all know the more palatable and more delicious foods are on the top of this, right? When you actually can't cut it back, cannot stop. And we always sometimes discuss from time to time, oh yeah, this is addictive. But this happens actually. And why the people are more talking about now less sweet, or maybe cutting down sugar, carbohydrates, taking in a form of low absorption potential, low glycemic index. I'm sure my some nutritional friends are also joining us today, so they will appreciate these food materials. So how they affect and how they make it more dangerous in terms of addiction potential. Pizza, cookies, chips, cakes, popcorns, buttered, when we eat it in cinemas. Moving on to look at apple, corn, when it is not buttered or salt, salmon, banana. Even you see between fruits, the apple and banana, they have difference in their prevalence, because banana has a different type of carbohydrate, different type of sugar or sweetness. Apple can be felt and can have more content, sweet and palatability. Carrots, brown rice, you coming at the bottom, So these are some examples from this study that how people have found that which food is less and which is more according to their potential of addiction. I've recently had a chance, actually, it's coincidence, last week I was in America, it's American Psychiatric Association, met with Professor Gerald Hart from University of Michigan, and who with her associates from Yale has come up with Yale food addiction scale. It has been before and now it is upgraded, which actually cover these few items. I think overall what we are looking at, what we're looking at, that people have strong urges to eat certain types of foods. We know that, and especially which we appreciated one with more sugar content and more fat when they more. So the stronger urges to eat certain types of food, and they think of anything else at least once a week, sort of thing. I have I've tried to go through various studies, and the people who have failed to cut down on stop eating certain foods 2 to 3 times in a week can be dealt with these. And tolerance to food increases similarly as it increases the addiction. And when people spend too much time obtaining and consuming junk food, so junk food, interestingly, has been now classified as a substance of abuse. So people actually, they give up some recreational activities. Sometimes you probably have seen, you will come across, although you may not appreciate it clinically, but you come across people, they can actually get laid from their commitment, from the occupational activities, from their educational or their recreational activities, just for the sake of food. Not food to just feed their hunger, but when they're addictive. There are lots of things associated with this. There's highly rewarding. Some people can use it, but we're talking about in a clinical scenario here. And when people can be in emotional problems, if the food is cut out or they don't get the food of their choice, when there is inability to fulfill their obligations at least once a month, they can be considered as addicted to food. And there's an increased risk of physical harm, such as while driving at least once a month. For example, people are prone to getting more into trance-like phase or maybe getting more drowsy. We have noticed, if you consider, I can remember from Lahore, having a big glass of lassi in the morning can increase drowsiness. So similarly, so forth and so on. And the people can also feel ill at ease. Just talking in respect of these various points would be considered. So this specific scale has 35 items and symptom control from 0 to 1. So similarly, again, I'm bringing this slide with a little bit of, being brave, that how naltrexone and bupropion, substance use disorder treatment approach, we can apply for this. And the studies have shown, I have given the reference, that naltrexone and bupropion has proved effective in reduction of food addiction symptoms in adults. A lot of 12-step programs have developed in West North America, especially, and over the years, there are thousands of meetings around the world under the name of Overeaters Anonymous, Food Addict Anonymous. They're already working. There is need to be, however, more evidence and more scientific evidence in terms of, developing randomized controlled trials to get the more robust result out of these. And different approaches need to be evaluated just in the face of their efficacy, not to say the least, such as CBT. We all know that has been tried and tested. However, for this, need to be having proper trials and proper conduction of the treatments with specifically for this disorder. So motivational interviewing, trauma focused, because we know that the basis of eating disorders and so the food addiction are some trauma or issues with previously, maladaptive or traumatized behavior. Can also try to use harm reduction approach, contingency management, and one has to be really productive or very creative, innovative here to look at the risk factors in individuals rather than more generalizing. So these factors which have been highly effective in substance misuse behavior, so you can apply and develop according to the needs and the risk factors in individuals with food addiction. Now, just to give it a thought, I know still people have been thinking, or I mean, it is really difficult to bring it at par with addictive disorders. So I am just asking question myself, what is the evidence that highly processed food is not addictive? While we have the evidence that it is contributing to hundreds and thousands of preventable deaths every year, interestingly surpassing alcohol and on par with tobacco. Trigger dopamine release as, similarly in the magnitude as with nicotine, alcohol, or other addictive psychoactive substances. So these, when the highly processed food is consumed compulsively, both in the form of junk food, we call it, and or sometimes some specific type of food, which people get addictive. They crave intensely about it, which is highly reinforcing. And searching through the literature, more than 400 empirical articles so far has been on highly processed food as a substance use disorder. So I think this makes us think that we should not take this topic lightly. It has a gross significance in terms of identification, research, service development, and looking at the treatments, research in the form of randomized controlled trials. So with this brief presentation, I don't know whether you have any questions or you want to take it at the end, whatever way should be okay.
Thank you, sir. So students, if you have any question, you may ask him.
Could be a conference of sleeping disorders. Okay, any questions? How many of you eat junk food? And you agree you eat junk food. So how many of you have listened to the different aspects of eating disorders during this conference, and how many of you think that you will now reduce the intake, not stop, reduce the intake of junk food? Only 2? Oh my God. That's an honest reply. So the real impact of this conference, देखें कि हम बच्चों पे इतना impact नहीं कर सके.
So this actually confirms really when we talk to somebody who's addicted, initially you have to work on motivational interviewing. And it was very brief, although there are a lot of aspects, how much physical harm food addiction does. And annually deaths, we have thousands and thousands due to obesity, diabetes, hypertension, you may talk it, and of course, road traffic accidents. And there are, interpersonal difficulties when you don't get the food of your choice. So, and so asking some friend to give us a treat or going into a party, you don't get food of your choice. And it is a real problem, actually. People get emotionally disturbed. So I think our youngsters are now start thinking about it, that we need to, there is a time to move towards more healthier eating, and looking at in our clinicians, I think we may set up some time in our clinics to identify this. We can work on this. I'm very interested to work on this Yale food addiction questionnaire to identify the problem and the extent of this, to develop surveys or a clinic or further research, and only then we can provide the treatment strategies and help to our population.
Dr. Saab, Assalamu alaikum.
Yes, Assalamu alaikum.
Maybe comment or question on something I want you to shed light on. As I have gathered, there are a few psychotherapies or maybe small techniques to handle anxiety and stress issues that focus or suggest eating
as a compensation maybe, or as a stress reduction technique, and specifically when food savoring or mindful eating. And generally, I have noticed that in such type of techniques, the person is suggesting you to choose something you really enjoy. I mean, for that purpose, I feel that in that case, within the psychology, there is, I feel it's a bit contradiction where we are suggesting people to go with type of food they want, not the type of might actually like manage their hormones imbalance if there are something, or their emotional imbalances, or maybe cravings or compensatory behaviors. So what do you say about it? Because this is really part of some therapies where food savoring and mindful eating is suggested as a remedy or a therapy.
I think that's very interesting, Dr. Sabke. When we say go and take things you enjoy, we automatically, we would like to exclude. We don't want to say people, okay, people say who are addicted, they enjoy their drugs or alcoholism, for example, even social drinkers. Nobody would say go and enjoy to compensate your depression or anxiety with alcohol. So here we need to tell the healthy activities, like healthy hobbies, like exercise, walks, spending time with friends, family. And if we talk of food, and then they need to, I don't think food can be put in that category. I would be very reluctant, to be honest. If there is anything, I would try to, try to give them a little bit help to identify that, avoid, because in stress, we know that it is a big risk factor for addiction. And if somebody is going to relieve their stress with food, they can be very easily stressed to highly processed food, which are more tasty, highly processed, but their consequences toward the raised cholesterol, raised sugar level, so problems, and in the long run, they stop realizing. You might have come across some examples, I think is anecdotal. If you speak to somebody who's really affluent, the people will say, oh, Dr. Saab, ਹੁਣ ਅਸੀਂ ਆਪਣੇ ਘਰਾਂ ਤੇ ਅਬ ਰੋਟੀ ਵੀ ਨਹੀਂ ਖਾ ਸਕਦੇ ਤੇ ਕੀ ਕਰੀਏ ਫਿਰ? So they don't appreciate that it can be poison in itself. So after all, now people scientifically started talking about this, that it is equivalent to substance use, or although it is not in that category chemical, it is a natural, but as you increase the quantity and the amount and the potential, it relieves, because of the more tasty food and with more sugar or fat content, it can be highly gratifying. So similarly, that principle applies to the drugs of abuse. They have high addictive potential, those sort of things. So coming back to that point, I think I would be reluctant to not educate people about food and simply saying, go and take things which you enjoy.